Team care plays an integral role in the oncology care model and other alternative payment models. With new quality metrics at play, patient care needs to be highly coordinated.
One of the tenets of the oncology care model is team-based care. We're trying to move away from a physician-driven system to a team-based system where we're utilizing the providers we have in our practice up to their abilities and their licensure.
Team care helps coordinate these required patient touchpoints, clearly delineating roles and responsibilities for each care team member. This is referred to in the oncology care model as patient navigation.
I feel very strongly that team care is an essential part of practice transformation. I believe if practices are going to succeed in the oncology care model, they have to adopt team care.
Although adjustment to team care can be bumpy, the experience for practices and patients has been positive in pilot practices. Practice staff report increased morale and better informed physicians and clinic staff.
Team care is getting back to taking care of a patient as a group of providers. We've gotten siloed in our patient care over the past few years, where you have the physician doing their job, the nurse doing their job, the infusion room doing their job, and no one has really sat down together and talked about patients. But also it's improving the quality of life for our staff as well, because everyone's feeling as part of the team again. They feel connected to the team.
A lot of the feedback has been much easier communication and a perceived easier access into the clinic with the patients who have the navigator, because there's just more touch points there. Not that patients are usually quite polite. They usually say their care is good anyway, but it had seemed to be physician-driven before, and now they identify more with the other care team members and feel more confident approaching them with specific questions.
Because each member of the care team touches a patient, it's important that practices foster a team environment, create forums for open communication, and clearly delineate roles and responsibilities between care team members.
Team care starts with having clearly defined roles and responsibilities. What is the nurse responsible for? What is the nurse practitioner responsible for? What is the MA responsible for? And clearly delineating that amongst the team. So the ability of the team to have set aside time to discuss specific patient issues will improve overall care.
Implementing team care takes time. It's a culture shift and requires buy-in from all of the staff and especially leadership. It also takes communication. Frequent communication is key to engaging all areas of the clinic on patient care.
The key to implementing team care is really having a strong physician champion. The physician has to be involved. They have to be the leader, but they also have to listen. And they have to step back a little bit and let the team take over some of the responsibilities and be able to have a voice in the team care as well.
The nurse navigators, the infusion nurses play a role, our advice line or triage nurse. We are huddling with these people on a weekly basis. We're reviewing all of the active patients in the oncology care model pilot and talking about some of the high-risk people, some of the people we're concerned about. The triage nurses are communicating with the physicians are communicating with everybody else about people who we think are potential hotspots that maybe we should bring some resources down to bear on those folks.
I think the biggest part of team care is that we make sure we're listening to the voices that we don't normally listen to. Our MAs sometimes have really great insight into what's going on during the flow of patient care, and yet they feel like they are the least empowered person to speak up.
Team care may be a new concept for your practice, or perhaps you just need some refinement in how you function as a team. From finding a physician champion to clearly delineating roles and responsibilities and managing patient navigation, we can help.